Welcome to the Dengie Medical Partnership COVID-19 video update. This date is the 25th of March 2020. The Dengie Medical Partnership is a group of GPs providing primary care from Tillingham and Malensey medical centres. I want to discuss three things in this video with direct local relevance. One is the importance of social distancing and in particular shielding of vulnerable members of the community. The second is the measures that the practice is putting in place to support the response to this outbreak. And the third is the things that our local population can do to support themselves and others during the outbreak. It cannot be understated how important it is to reduce transmission of the COVID-19 coronavirus. You'll all have heard from Boris Johnson, and you've probably already had a text linking to the Gov website for national coronavirus advice. You'll be aware of the NHS 111 website and the information there is about it. Please do take this seriously. The practice is having to adopt totally new ways of working to follow national guidance on maintaining social distancing and reducing transmission rates. We are still open at both Tillingham and Malensey medical centres. All repeat medications can still be ordered in exactly the same ways as before. See the tab on our website about this. We are issuing the same length prescriptions as usual. There is national guidance to avoid the toilet roll situation arising with the medicine supply chain. Please only order what you need and do not stockpile medication, because otherwise someone else will not be able to get the essential medications. All consultations with our team will now primarily be remote, either by telephone or video link. More about this in a moment. If there is an unavoidable need to examine you in person, we will plan how to perform this contact to minimise risk. To get a consultation, please ring the reception on our usual published numbers. Our staff will take your details and a clinician, either a doctor or a nurse, will phone you back as quickly as possible. Please be prepared to talk to any clinician to explain your problem. We have a very effective internal system for passing queries, and if the clinician who takes your inquiry doesn't have an answer, they will find someone who does. We now need to defer all routine care. This includes blood pressure checks, blood tests and most injections. We will publish a list on the website of essential treatments that will continue, things that simply cannot be mitigated or deferred. We will also be reviewing care needs on a case-by-case basis. We cannot now refer you for diagnostic tests or consultations with the local hospital unless they are life or limb-threatening problems. Now, just a word on telephone, video and online consultations. Adapting to this new environment, we have adopted some new digital solutions. In addition to the old-fashioned telephone, some consultations can be enhanced by video or can be done by email or text. We have started using a piece of software called AccuRx to support this. This does require patients to have a smartphone with a camera, but does not require patients to have any particular app on their device. If a video consultation is required, we will send you a secure link by text which will open up the video consultation. It looks and feels very like Skype. Across the Mid-Essex area, the group of GP services is looking to use another layer of technology, something called Dr. Link. This is not yet live, but will be soon. This software does require a smartphone app. Patients will be able to use this software to check their symptoms and send their concerns to their doctor to be considered. This can then streamline the process of deciding what needs to be done for each person. We are still encouraging people to sign up to use the existing online system, and you can see our website for details of this. This system already allows ordering of medication and viewing of medical records and results. You do need to bring your photo ID to our reception to get log-on details to start using this service. Additionally, there is a new phone app just released called AirMid, which interfaces with the online system using the same login details and provides a simple menu for patients to use on their smartphone. Eventually, the AirMid app will also be used for providing video consultations. You can see that there's a lot of change here. It does sound a bit daunting. I can reassure you that it's not as complicated as it sounds. Many of our staff are not technophiles either. And if the worst comes to the worst, we can sort it out by good old-fashioned phone contact. Third section, what can you do to support yourselves and the local community? Firstly, stay informed regarding national guidance, but do take some time out to do something relaxing. Perhaps use your newfound downtime to do those things at home that you've been sidelining, or take up your hobbies again. Remember to get your exercise once daily, but keep your distance from others. At this time, it's very easy to lose ourselves in the general anxiety of the coronavirus pandemic. It's all over the news and the world has changed. This is going to be a marathon and not a sprint, and we do need to keep ourselves positive to get through this. There are many online resources with dedicated pages about coronavirus, for example, Anxiety UK or the Mind website. If it's feeling a bit overwhelming, please do try looking at these. Secondly, consider those around you who may need support. There are many groups who are now instructed to lock themselves in at home due to their vulnerability, and they do need support to get essential supplies and to keep up their spirits. Volunteering groups are springing up locally and nationally. We will post examples on our website for people interested, but these do include the Good Samaritan app, or Good Sam app, which launched a national appeal 2 days ago, the Essex Coronavirus Action Group on Facebook, which is linked to Volunteer Essex, and of course Age UK. When participating in voluntary activities, please be mindful of the vulnerability of the people requiring support, and do not distribute lists of isolated people publicly. If you've now got time on your hands and you'd like to help others, then there will be likely something that you can do, even from your own home. We will update you as time goes by with fresh news.